Control and Prevention has just announced the first case of Ebola. First case has been diagnosed in the United States. It's a troubling milestone in the spread of the disease, which has now killed thousands of people in West Africa. We're standing by for a news conference by the CDC, the Centers for Disease Control and Prevention. That's coming up in about a half an hour. We'll have live coverage. We also have complete coverage of the other breaking stories we're following with our correspondents, our guests, including President Obama's senior advisor, Dan Pfeiffer. He's here with me in the Situation Room. But first, let's bring in CNN's chief medical correspondent, Dr. Sanjay Gupta. Sanjay, what do we know about the first confirmed case of Ebola in the United States?
Well, what we know is this is a person who they had some suspicion given where the person had recently traveled, West Africa, and this person was having symptoms, having high fever and symptoms that were consistent with Ebola, but also, could be a lot of other things. What they did in this case, and they've done in several cases in the past, is they simply test the person's blood, sent those specimens over to the Centers for Disease Control, and waited to see what it would find. Keep in mind, Wolf, this has happened several times in the past, but all those previous times that the test has subsequently come back negative or without any evidence of the Ebola virus. This time we're hearing, and as you mentioned, within a half an hour you're going to hear from the CDC themselves, but they are talking about the fact that this particular specimen did come back positive. So while we have had other people in the United States who have had Ebola, keep in mind they were diagnosed with Ebola elsewhere and then flown to the United States for treatment. This is the first patient who was in fact diagnosed here in the United States. As you said, Wolf, this is it's historic in some ways. It's a milestone, but not unexpected, I think, given how much we've seen Ebola sort of spread over the last several months. And it's spreading by enormous rates in West Africa. There's alarm going on right now. Thousands and thousands of people have been infected, and thousands have died, and could go up and up and up. So the question everyone is asking in the United States right now, hearing you, Sanjay, how concerned should we be in this country that Ebola could come here? Well, Ebola's here. I think that's, it's one of those things that I think is a little startling, maybe even jarring to hear. But Ebola has been in the United States. In some ways, it arrived when those first patients arrived a couple of months ago now. But now we've seen someone who's been diagnosed here having traveled from an area that was known to have Ebola to the United States. The big question, I think, what people are really trying to figure out, is it going to start spreading within the United States? That's the big concern. And what I would say is the same thing I think we've been saying for months, and the likelihood of that happening is still very, very low. This is not a particularly contagious disease. Despite the numbers and obviously despite some of what you've seen in West Africa, this does not spread easily from person to person. Typically, people will spread this when they are very sick. That is when their body starts to shed the virus. So, and typically when someone's very sick, they're not up and about. They're typically in bed, oftentimes in a hospital. So it's certainly concerning, not unexpected, but I think this idea that we're going to start seeing these outbreaks in the United States, I still maintain, I think, is relatively low, Wolf. All right, Sanjay, I want you to stand by at the bottom of the hour. We're going to have live coverage from the CDC on what we know precisely. The first confirmed Ebola case now in the United States, first case confirmed in the United States. Sanjay, thanks very much. There's other breaking news we're following.